You could always send a bottled message in the sea. Yes, just like a genie wrapped up in a bottle. If you want to send it in the landlubber way, give it to me. I'll give you letters and cards, whatever your pleasure. Today, I will even give you the treasure. Yes, just think of the answer of this riddle. It's a beautiful riddle, a really poetic depiction, and what I want you all is to just quickly guess the answer of this riddle. Well, one more hint I'm gonna give you in this regard, and it goes something like another riddle. Benjamin Franklin, the flyer of kites, scientist, statesman, with sharp-witted sight, first of the master of post office corps, guided the post from the farthest of the shores. Okay, now that's enough for the answer to be discovered. And yes, the answer is the mailbox, the classical mailbox. This is a poetic, delicate yet powerful expression of letter glory. I have also received the mail for the day, and this mail is having its topic as the plasma protein binding. So let's just dive into it. Welcome all to Is Pharmacology Difficult podcast. I'm your host, Dr. Radhika Vijay, MBBS MD Pharmacology, and this is the audio hub to get the best, simplified basic tips, strategies, methods, and lots of ideas to learn better, understand better, and make your concepts crystal clear. If you really find, and if there's a question hovering in your minds, is pharmacology difficult? Lend me your ears for a while and let in the magic of knowledge. Plasma protein binding. It's a powerful drug reservoir. Now, drugs, after binding, they stay in the reversible and dynamic equilibrium state. You can have an equation for this state, and I'm going to give it to you just now. Free drug plus protein, that is a reversible arrow equal to drug protein complex. Just remember, the arrow is reversible. This is a reversible state, a purely dynamic state. Got it? Now, this is a drug reservoir set in motion in the circulation. All the actions, they are assigned to the free form of the drug. It is the free form of the drug that is acted upon, metabolized, filtered, etc. Once the elimination of the free form of the drug begins, more of the bound drug is freed. Okay, that's the whole process. Now, you need to know few things. They should be really tied up nicely as a knot. Let's start with them. First, albumin is very important, especially in binding of the acidic drugs like penicillin, salicylic acid, warfarin, etc. Second important point, for basic drugs like quinidine, lidocaine, propranolol, what do we have? We have alpha-1 acid glycoprotein, that is abbreviated as alpha-1 capital AGP. Now, one of the types of this alpha-1 acid glycoprotein, its concentration shoots up during the states of stress and disease. What can be the diseases that makes this concentration shoot up? They can be myocardial infarction, they can be cancer, arthritis, etc. Third point you need to know is that tissue protein, it serves as a binding of the drugs. It binds digoxin, chloroquine, and specific drugs binding proteins. They are also present in our body, like corticosteroid binding globulin that binds the steroids. Then alpha globulins, they bind the globulins. Then gamma globulins, they bind the antigens. And this corticosteroid binding globulin is also termed as transcortin. Okay? Now, after knowing all about this plasma protein binding, we need to have something as summary in our hands. And now let's summarize it very nicely. The first point goes on. After the plasma protein binding, the drugs, they restrict themselves to the vascular compartment. And there, if they are having a very low volume of distribution, then such drugs, they cannot be removed easily by dialysis. Especially, I'm talking about the poisoning cases. I hope you understand this really nicely. So we can say that plasma protein binding is a capacity limited process. It gets saturated, yes it does. Now some of the pathologies that lead to the decreased albumin levels than the normal drug doses, they result in higher free concentration of the drugs. And similarly, we have few of the pathologies that I already told you, like myocardial infarction, inflammation, stress, etc. They lead to increase of alpha-1 acid glycoprotein. And if that rises, then binding of the basic drugs increases. So if the albumin levels are decreases, then the free drug concentration is increasing. And if the alpha-1 acid glycoprotein concentration increases, then the binding of the basic drugs increases. Don't get confused, that's quite simple. Just listen to it once again, and it's so simple you'll get to know it. Second point, as a summary we get to know, now one side favors the binding of more than one drug. Yes. What I want to tell you about this is, what is the importance of this particular sentence? The displacement reactions, they occur a lot. If there is increased of the free drug, then that is responsible for the increased adverse drug reactions also. Okay? Now, due to the most of the drugs, they are following the first order elimination kinetics. Now, what is that thing? I'm going to tell you in my upcoming episodes. Just get to remember that most of the drugs, they follow the first order elimination kinetics. And that is directly proportional to the clearance. So if that increases, then clearance also increases. And that is another summary point. Next we need to know is that acidic and basic drugs, they are not displacing each other, not even vice versa. Okay? So these are few of the important summary things that you should keep in your mind, because everything is bound by rules, some strategies, certain fixed notions and ideas. If you just keep them in mind, you get your concepts and you can apply them. If you don't understand the basic notions, the basic idea behind everything, how will you get to understand the basic mechanism? So, these are some fixed things that happen. They may not happen, there are exceptions. But once you start getting into the subject, you get to understand so many new things. And that is really wonderful. Now, quickly get to understand the mechanics of the drug interactions. There are few governing rules and strategies again that I want to tell you. The importance of the drug interactions lies only when there is more than 95% of displacement occurring. If it is less than 95%, drug interactions make no sense. Secondly, the drugs should have a very low volume of distribution. And then only their toxicity can occur, and there is need and there is a sense of understanding the drug displacement reactions. Now, especially I'm talking about in the plasma where the drugs are present in the free form. Next point you need to know is that basic drugs, they show less displacement reactions because their binding sites, they are quite different from the acidic drugs. And yes, they have large apparent volume of distribution also. So that is why basic drugs, they are not showing displacement reactions as much as acidic drugs are showing. Got it? Now that's also an important factor. Let's come to the examples. Yes, the much awaited wonderful examples. Some good to know examples, they are sulfonamides, vitamin K, they displace the endogenous substances like bilirubin, and that is the basic cause of the occurrence of kernicterus in the newborn. Second important example is phenylbutazone sulfonamide salicylates. They displace the tolbutamide. That leads to the occurrence of hypoglycemia. I want to tell you few more points, so better listen them nicely. Plasma protein binding makes drugs long acting because they are restricted to the vascular compartment. Secondly, not always the drug displacement reactions are occurring. Now, for that, I want to give you an example of probenecid and indomethacin. They both are bound to the albumin because they are acidic drugs, but they do not displace each other. Okay, so it is not a common rule that drug displacement reactions will definitely occur and occur. No, they may not occur. Okay? And last important point, if there is a decreased albumin state, then high free drug concentration occurs, and phenytoin, furosemide, etc., they have high drug concentration. Then pethidine is a drug. Its binding decreases in uremia condition. Propranolol is another drug. Its binding increases in the pregnancy states. So these are a few of the exceptions and things you should know. Now, just a small table in case you want to do some pen paper exercise. Let's start with it. Just a little very small table, and that's really interesting. So just write down what are the drugs that bind to the albumin. Benzodiazepines, non-steroidal anti-inflammatory drugs, penicillin, sulfonamides, warfarin, tetracyclines, they all bind to the albumin. Second list I want to give you for the drugs binding to the alpha-1 acid glycoprotein. They are beta blockers, verapamil, imipramine, lidocaine, quinidine. I hope you have done some pen paper exercise and really enjoyed the whole session for the day. Now with this add-on list of the drugs that I just gave you, I'm gonna knock off for the day. Hope you are still wondering where the mailbox memories, they are getting lost and getting faded away. These are actually some beautiful classic commodities, facilities given to us, and they are always treasured. They are again and again revisited as we remember them. The beauty lies in abandoning the past and surrendering to the growing age of technology. That's really true, you know. For all the updates and latest episodes of my podcast, please visit www.ispharmacologydifficult.com, where you can also sign up for a free monthly e-newsletter of mine. It actually contains a lot of updates about the medical sciences, drug information updates, and my podcast updates also. You can follow me on different social media handles like Twitter, Insta, Facebook, and LinkedIn. They all are with the same name. Is Pharmacology Difficult? If you are listening for the first time, do follow and subscribe whatever platform you are consuming this episode. Stay tuned. Do rate and review on iTunes, Apple Podcast. Stay safe, stay happy, stay enlightened. Thank you.